Doctors took a look at man's painful shoulder, they found the joint was missing. The leverage shift starts now. Here is the signal that separates noise from actionable change. We will map trigger, incentive shift, and downstream impact before the close. Routine visit, right? Wrong. When they took imaging, they found something that shouldn't be possible. His shoulder joint was completely missing. Not damaged. Not deteriorated. Actually gone. This isn't a freak accident or a surgical error from decades past. This is a real case, documented and analyzed, and it reveals something critical about how our bodies fail in ways medicine still doesn't fully understand. Here's what makes this medically significant: the shoulder joint, the glenohumeral joint, is held in place by a combination of bone architecture, muscle, ligaments, and something called the rotator cuff. It's one of the most mobile joints in the human body, which means it's also one of the most unstable. But it doesn't just disappear. Except in this case, it did. The technical term for what happened is called a glenoid erosion, or more severely, severe glenoid bone loss. Over time, repetitive stress, inflammatory conditions, or in rare cases, previous injuries and poor healing can cause the socket of the shoulder, the part that holds the ball of the humerus, to wear away almost completely. But what makes this case extraordinary is the degree of bone loss. We're not talking about mild wear. We're talking about a joint surface that had essentially eroded away, leaving the man with a non-functional articulation. Why does this matter beyond just one patient? Because it forces us to ask a harder question: how many people are walking around with progressive joint deterioration that they don't know about? The shoulder isn't weight-bearing like the knee or hip, so compensation happens silently. The rotator cuff muscles work overtime. Pain becomes chronic. People accept it as normal aging until they get imaging. The second critical insight is what this tells us about early detection. This man's condition didn't happen overnight. Joint erosion is a slow process, usually taking years. Every year without diagnosis meant more damage, more scar tissue, more compensation patterns that make the joint worse. If imaging had caught this earlier, say, at 30% bone loss instead of 80%, surgical options would be completely different. At advanced stages, you're looking at joint reconstruction, artificial shoulder implants, or even fusion. Early, you might address the underlying cause and halt progression. Here's where the tech and medical workflow angle becomes critical. Radiologists are increasingly using AI to detect subtle joint changes before they become catastrophic. Computer vision systems trained on thousands of shoulder images can now flag early-stage glenoid erosion with higher sensitivity than human radiologists reading the same scan in real time. This isn't about replacing doctors. It's about changing the speed and consistency of diagnosis. A radiologist might spend 30 seconds on a shoulder X-ray during a routine checkup. An AI system flags anomalies in milliseconds. That difference in detection speed, multiplied across millions of patients, is the difference between early intervention and late-stage irreversible damage. The stakes for patients are personal: joint replacement surgery, months of rehabilitation, chronic pain management, and years of functional limitations. The stakes for healthcare systems are systemic. Better diagnostic tools mean fewer catastrophic surgeries downstream, fewer chronic pain cases in the system, and earlier intervention at lower cost. But here's the contrarian angle: not every joint erosion needs immediate aggressive intervention. Some patients live with significant bone loss and manage well with physical therapy, anti-inflammatory management, and activity modification. The real value isn't just detecting the problem, it's detecting it early enough to choose the right intervention pathway. That requires radiologists, orthopedic surgeons, physical therapists, and the patient all understanding what's actually happening. The future implication is this: as AI-assisted diagnostics become standard, the expectation will shift from diagnosis at symptomatic crisis to early detection during routine screening. That means more shoulder imaging in routine workups, more early findings, and a massive expansion in how we manage asymptomatic or minimally symptomatic joint deterioration. The man with the missing shoulder joint is an extreme case, but he's also a data point in a much larger trend about how early intervention, better diagnostics, and smarter triage will reshape orthopedic care over the next decade. This case is worth monitoring because it sits at the intersection of three major trends: AI-assisted radiology improving diagnostic sensitivity, orthopedic surgery moving toward joint preservation earlier in the disease course, and patients having better access to imaging that catches problems before they become catastrophic. Watch how this patient's treatment unfolds, and pay attention to whether AI-flagged early erosions start appearing more frequently in clinical literature. That's the real signal. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next. Watch the execution timeline, second-order market effects, and policy response to gauge what happens next.